Hello. On behalf of our physicians and staff, I want to welcome you to the Oregon Heart and Vascular Institute. We have developed this video because knowledge is essential to your recovery. Being informed allows you to be an active participant in the recovery process and have the tools necessary to lead a heart-healthy lifestyle.
Enhanced quality of life is one of the great gifts of modern cardiovascular surgery. Most people who have coronary artery bypass surgery or heart valve replacement surgery feel that it has changed their lives for the better. Still, it is natural to feel apprehensive and to have questions concerning the surgery and the recovery period. The main function of the heart is to pump blood containing oxygen and nutrients to your body. The heart pumps 100,000 times each day and needs its own oxygen-enriched blood supply. The coronary arteries, which lie on the surface of the heart, provide this blood from the aorta to the heart muscle. When you have a disease known as arteriosclerosis, blockages develop in one or more of these arteries, limiting blood flow. When the blood flow is not sufficient to meet the heart's needs, chest pain or angina may occur. During coronary artery bypass surgery, the surgeon makes a detour or bypass around the blockage in the coronary artery to improve the supply of blood and oxygen to the heart. Blood vessels from the chest, arm, or leg may be used to form the bypass. For some people, the heart valves may need repair or replacement. The heart has 4 one-way valves that control the flow and direction of the blood as it moves through the heart. Diseased valves may not open or close properly, which places a strain on the heart. There are 2 different types of artificial heart valves, mechanical or biologic, also referred to as tissue valves. Your surgeon will talk with you about which heart valve is best for you. For your convenience, parking for the Oregon Heart and Vascular Institute is in 2 lots. One in front of the OHVI entrance, the other is just south of OHVI. Both lots are restricted to Oregon Heart and Vascular Institute patients and their families. The following procedures and steps will give you a general idea of what to expect before your heart surgery. Everyone is different and procedures are tailored to individual needs. We make a special effort to include your family in each phase of your care. We encourage them to play an active role to learn about your care instructions before and after surgery. You will be scheduled for a pre-admission testing day. The reason for this testing is to be sure that we have all of the information needed to make your surgery as safe as possible. In addition, you will get more information about what to expect in the hospital and how to prepare for going home. This pre-admission process will take about 4 hours depending on the number of tests that you will need. On the pre-admission testing day, you can expect to have a chest X-ray, echocardiogram, and electrocardiogram, and have blood drawn for laboratory studies. You will meet with several members of your care team who will gather information and answer any questions. These may include a nurse cardiac educator who will review your open heart surgery notebook with you. You will get additional information about your surgery and the skills and aids to help your recovery. Receive a heart pillow to support your chest when coughing and breathing deeply. And be instructed in the use of a respiratory exerciser. The nurse will help you practice using both of these. You will be given a prep kit with supplies and instructions. A physician, physician's assistant, or nurse practitioner from the surgeon's office will check your history and test results. You will have the opportunity to ask questions related to your surgery, and you may receive a physical exam. An anesthesiologist will meet with you to discuss your anesthesia case. Please remember, you cannot eat or drink anything after midnight on the day of the surgery. Also, before coming to the hospital, leave all personal belongings at home, including money and jewelry, and all rings, including your wedding ring. When you and your family arrive the morning of surgery, you will be escorted to a pre-surgery area. You will be prepared for surgery with a hair clip of your chest, arms, and legs, and an antibacterial shower. You may have an IV started here or upon entering the operating room when medicine will be given to help you relax. A nurse from the OR will take you to the operating room while your family goes to the intensive care waiting area. During surgery, a pastoral care representative will come and give your family an update about the progress of the surgery. After surgery, your surgeon will meet with your family in the intensive care unit waiting room. You will go directly from surgery to the intensive care unit, or ICU. There will be a nurse at or near your bedside continually monitoring your condition. Your heart rhythm, blood pressure, temperature, and heart pressures are closely monitored at all times. All the tubes, wires, and machines may seem a little overwhelming to both you and your family at first. Let's look at what these are. A breathing machine or ventilator is used to regulate your breathing and assure that you receive adequate oxygen. This is connected to a breathing tube placed in your throat or trachea while you are in surgery under anesthesia. This tube will be removed when you can breathe on your own. You will feel this tube in the back of your throat when you begin to wake up, and you will be unable to talk, but you still are in control of your own breathing. Remain calm and breathe normally. You will have an intravenous or IV line in the side of your neck. This allows your nurse to easily administer needed fluids and medications. You will also have 1 to 4 chest tubes to keep your lungs well inflated and facilitate drainage of any blood left in the chest cavity after surgery. There will be 4 small wires coming out of your chest which are attached to your heart. These are precautionary in case you might need a pacemaker. These are removed before you go home. Your blood pressure will be carefully watched with a monitoring catheter. Another tube placed in your bladder during surgery will be for urinary drainage. The breathing machine and monitor in your room are equipped with alarms that may sound at any time. Their purpose is to notify your nurse of any change in your condition. These alarms may sound for a number of reasons, and they do not necessarily mean that anything is wrong. Sometimes nothing more than moving in bed can trigger an alarm. For your safety, and so that you do not accidentally pull on any of these tubes or monitoring devices, your hands will be softly restrained until you are fully awake. Your nurse will assess your level of pain and give you medication to keep you comfortable. After you are settled into the ICU and the surgeon has spoken to your family in the waiting room, your family can visit. Family should be aware that at this early stage of recovery, you will likely still be sleepy, appear pale and somewhat swollen due to the fluids given during surgery. This is normal after open heart surgery. Your nurse will help you sit on the side of your bed. Activity, even something as simple as sitting up in bed, is an important step in your recovery. Every 1 to 2 hours, you will be asked to use your respiratory exerciser, along with your heart pillow. You may need pain medication to do this. Do not hesitate to ask for the pain medication you need to keep you comfortable. You generally stay in the ICU until the next day. It is not unusual to not have any recall of your stay there. When you leave the ICU, you'll continue your recovery on the 4th floor of the Oregon Heart and Vascular Institute. There are several things you can do to support and speed your recovery. 1. Tell us about your pain level. We want your pain to be controlled so you can rest and participate in recovery activities. 2. Cough and deep breathe every 1 to 2 hours. Support your chest with your pillow to reduce pain. 3. Use your breathing exerciser every 1 to 2 hours. This helps open airways and clear secretions. Have your pillow close by to support your chest, as this may make you cough. 4. Allow us to assist you out of bed to a chair and gradually increase your walking. The easiest and least painful way to get out of bed will be taught to you. Walking supports your recovery. Cardiac rehabilitation staff will evaluate your strength and prescribe walking and activity goals. You'll be asked to sit in the chair and walk several times a day. The staff will assist you until you are strong enough to safely walk on your own. Your family is encouraged to help after they are taught. 5. Do your best to eat. Food will help you heal. During your hospital stay, nurses will inspect and gently clean your incisions daily. Your level of activity will be gradually increased. Expect to tire easily and experience some loss of appetite. It is important to take naps and balance resting with your walking. You will be able to take a shower after your chest tubes are out, your blood pressure is stable, and you are steady on your feet with enough energy to safely shower. In anticipation of discharge, many of our staff will help prepare you and your family for your continued recovery at home. We encourage the person who will be helping you at home to attend a home instruction class. During this class, instructions will be given regarding activity, diet, and incision care. Your questions and concerns will be answered. The Open Heart Surgery Notebook contains more detailed home instructions, including your self-care agreement. We also strongly encourage you to enroll in an outpatient cardiac rehabilitation program. The staff will explain the options and benefits of continuing this program. The activities taught in this program will help you regain your stamina as well as your sense of independence. You will also learn about diet and coronary disease risk reduction. Fatigue or lack of energy are common after open heart surgery. It will be several weeks before you are able to resume normal activities around the house. We recommend that someone stay with you for the first 1 to 2 weeks after discharge to assist you. Ultimately, the success of your operation and control of ongoing coronary disease depends on you. Our staff will do all we can to help you make a smooth and successful recovery. At the Oregon Heart and Vascular Institute, the best care comes from the heart.
It's common to feel tired after surgery. Many patients are anemic from blood loss during surgery. Your strength and energy will gradually return over the course of the next 6 to 8 weeks. Before you are discharged, you'll be given information about medications, follow-up appointments, and walking guidelines. Be sure to take your red folder home with you. After the doctor has examined you and determined that you are ready, he or she will write the order for discharge from the hospital.
All right, Mr. Jones, then tomorrow we'll have you ready for discharge, and we'll give you an appointment to see
Dr. Robert Shower. Dr. Robert Shower.
It's important to keep in mind your body's anatomy and what happens to it during surgery. This will help you adjust to the limitations of movement and activity you'll need to follow. During surgery, the sternum or breastbone is cut down the center so that the surgeon is able to reach your heart. When the surgery is over, the surgeon puts the two halves together using stainless steel wires. These wires hold the sternum together while the bone heals over the next 2 to 3 months. The wires are not removed. After surgery, to allow the sternum to heal, you should not lift anything heavier than 5 to 10 pounds for the first 6 weeks, and lift nothing heavier than 10 to 16 pounds for the following 6 weeks. Do not push, pull, or strain for 6 to 8 weeks after surgery. Once healed, Your sternum will be as strong as it was before surgery. After you've returned home, it will take a while to return to all your normal activities. Remember to strive for a balance between rest and activity. At the beginning of your recovery, you may want to limit the number of visitors to your home. It's very important to get out of bed and get dressed every day. This will establish a routine of daily activity in your life. For the first 2 weeks after surgery, weigh yourself every morning. Be sure to empty your bladder before you step on the scale. Call your family doctor if you notice a gain in weight of more than 2 pounds a day, 2 days in a row, or if you become increasingly short of breath. Be sure to take your medications every day. Remember to take pain medication as you need it. During the first week at home, you are doing well if you're able to get dressed, shower, walk, and eat at the table with your family. Use common sense about how much activity to take on in your day. Getting back to regular eating is a challenge after any major surgery. It's common to feel full or not interested in eating. You may not like the taste of the food you're used to eating. Rest assured, these problems are temporary. Normal taste usually returns within 1 to 2 weeks after surgery. In the meantime, try cold foods. They often taste better. Please remember, it's important to eat even if you are not hungry. If you're eating half of what you usually do at meals, you will need to have snacks between meals and at bedtime. Keep in mind, you don't need less food after surgery just because you are less active. Your body will need as many calories for your recovery as it did before surgery. The danger is that weight loss now will cause you to lose the strength vitally needed for recovery. Even if you are overweight, keeping your weight stable will help you recover more quickly. Your food choices can be more liberal if you're having trouble eating, so it is okay to add extra foods that are high in calories and protein, such as a nutritional supplement drink or a homemade milkshake. It's also important to eat foods lower in sodium, at least for the first few weeks after surgery. You will also need to take a multivitamin with iron for the first 6 weeks. We recommend that you rest for about an hour after each meal before starting a new activity. When resting, elevate your legs to reduce swelling. This is a good opportunity to use your respiratory exerciser. For the first 2 weeks after surgery, you should use the respiratory exerciser 4 times a day. This will help you to reopen the smaller airways in your lungs. When you cough, it's important to use your heart pillow to support your chest incision. Soon after discharge, you should be able to climb stairs, although you may find it tiring at first. If you have a long flight of stairs you need to climb at home, we recommend that you plan your activities so that you climb them only once or twice a day, at least for the first week or so after surgery. Be sure to go up the stairs slowly and take the time you need to rest. It's important to look at your incisions daily. A small amount of clear or pink-colored drainage is typical. Many patients have a lump or a small amount of puffy swelling at the top of the chest incision. You may notice a small amount of redness and tenderness along the incision line. These are common signs among open-heart surgery patients and should gradually disappear. Arm and leg incisions seem to heal more slowly than chest incisions. Bruising or discoloration is common around the incisions. This too will gradually disappear. Stitches that dissolve in 2 to 3 months are used to close your incisions. Call your physician if you think your pain is getting worse or if you notice pus-like drainage, increasing redness, tenderness, or swelling in or around any incision. Shower every day. Use only warm water, not hot water, and plenty of plain, everyday bath soap. Gently wash your incisions, rinse well, and pat dry with a towel. Until your incisions have completely healed, please avoid using any lotions, creams, ointments, or powders on your incisions. Products to avoid include aloe vera, neosporin, and vitamin E. Walking is a great way to recondition your body. Use the walking guidelines prescribed by the cardiac rehab therapist to get started. This can be found in your red folder. Keep in mind, this walking plan is in addition to your regular activities when you're up and around in your home. You should be able to go to the table for meals, use the bathroom, and go for your prescribed walks. During your recovery, don't hesitate to call your doctor if you experience any of the following: increasing or unusual pain in the area of your incision, nausea, vomiting, diarrhea, or fever that lasts longer than 24 hours, sudden weight gain, increasing shortness of breath, any sign of infection around your incision, a rapid or irregular heartbeat that causes dizziness or lightheadedness or sweating. You will need help with household activities, especially those requiring lifting or exertion. For the first 6 weeks after surgery, avoid any housework that requires straining, such as vacuuming, mopping, or moving furniture, and avoid heavy yard work, such as working in the garden or mowing the lawn. It is common for people to cry more easily or be more emotional after heart surgery. It is also common to be forgetful and have trouble concentrating. Sleep patterns may also be changed, and you may have bad dreams. These things are related to anesthesia, the heart-lung machine, medications, and loss of sleep. You will gradually feel better over the next 6 weeks. Do not drive for 1 month after your surgery. This should be enough time to allow your sternum to heal. We do encourage you to go out. It's a good chance to get some sun and fresh air to boost your mood, just as long as you have someone else do the driving. A variety of resources are available to help support you in your recovery, including the nurse educators in the Oregon Heart Center, dietitians, your family physician, and the cardiac surgeons. We recommend that you participate in a cardiac rehabilitation program after your discharge. This program will help you get back on your feet again. Ask your cardiac rehab therapist for more information.
Cardiovascular surgery, this is Carol. May I help you?
Mr. Jones is well on his way to a full recovery. If you follow the simple guidelines in this video, you should also be in the same shape by the time of your 6-week post-operative visit. Remember these basic rules. Do not push, pull, lift, or carry anything weighing more than 5 to 10 pounds. It's important not to put any undue strain on your sternum as it heals. Stick with your walking plan. It is the best exercise for your heart. Take care of your incisions daily. If you notice pus-like drainage or an increasing redness or swelling, call your doctor. Trust your own common sense and don't hesitate to ask questions of your doctor or any of the hospital staff. For the first week you're home after surgery, get help from someone who can be around for most or all of the days. You will continue to need help with lifting, house cleaning, laundry, and driving for 4 to 6 weeks after that. Long-term goals include eating foods that promote good overall health. We've provided a booklet to guide you in the direction of consuming more whole grains, fruits, and vegetables. Remember also to eat smaller portions of lean protein foods and low-fat or non-fat dairy products. Try to avoid added fat and fatty foods such as fried foods, fast food, butter, margarine, and high-fat salad dressings and condiments. Using the resources available in your community, such as registered dietitians and cardiac rehabilitation programs, will help you establish and keep your new heart-friendly lifestyle.